Okay. Now, this is another study about 20 years ago. It's a Swiss study. It's large, involving over 700 college students, young folks about 20 to 30. They were divided into two groups, test groups and control group. And those students who develop symptoms would be given vitamin C or placebo and other. Basically, the vitamin C group were receiving vitamin C, of course. The control group, the other group, were receiving pain relievers or nasal decongestants, like what we ordinarily would, right? The VC group, this is 20 years ago, and very interesting, is that the VC group were receiving high doses of vitamin C. The treatment today we recommend is very similar, is that these people would receive 1,000 milligram or 1 gram of vitamin C every hour for the first 6 hours, and then followed by 1 gram 3 times daily. Okay, so at the end of the study, they concluded that the vitamin C group reduced the cold symptoms by 85%, which is very high, right? And there was another arm of this study, is that this is a prospective study, so happened not like a review of the literature, but about prospective. And so those people who did not develop cold symptoms in the test group would be taking were taking vitamin C 1 gram 3 times daily. And the analysis also showed that the vitamin C 3 grams a day appears to be able to reduce the risks of catching cold. And I didn't put on the slides here, which I should probably, is that some of these negative studies in the past that shows that vitamin C is ineffective in preventing or treating colds, they're almost always very low in dosage. So dosage is the key. Anything like the drugs too, like food, right? Food can treat hunger, but if you don't eat enough, it can't. Same thing here. So the dosage is key. Whenever somebody tells you vitamin C doesn't work, check the dosage. Now let's talk about, so far we've talked about the effectiveness in prevention and treatment of various viral conditions, including COVID-19. Now let's talk about safety issues. Vitamin C is very safe, low dose or high dose, oral or IV, okay? Let's talk about IV. Now, there are a lot of research in the past. Here are listed some major one of them. These are all clinical trials. And I want to mention to you that the NIH, the National Cancer Institute of NIH, published a regular document called PDQ, Physician Data Query. And the PDQ is a sort of like a review document on controversial drugs or molecules. And vitamin C is a frequently discussed topic in the PDQ. So if you Google it, PDQ and vitamin C, you will find these documents. They have these documents for professionals like doctors, and also they have for consumers, easier to read, okay? Now the PDQ lists all these references in there too. Now let me give you this, that high dose vitamin C has been generally well tolerated in clinical trials. This is quote unquote from the NIH document, okay? Now high dose here, we're talking about 1.5 grams per kilogram body weight. What does that mean? For a 70 kilogram body weight, which is only roughly about 150 pounds, 150 pound person in the United States is slim. Okay, we know that. A lot of people are heavier than that. So even for somebody of 150 pounds, that we're talking about 100 grams vitamin C. And so far you've heard me talking, the dosage used in these clinical treatments and trial has been highest is around 24 grams, right? So here we're talking about 100 grams or higher. Now let me tell you, I use high dose vitamin C in cancer treatment. And I'm also a certified integrative oncologist. And when we treat cancers, the mechanism is different, I have to warn you. that when we treat cancer patients, I usually use up to this high dose. Okay, even at this high dose, 1.5 gram per kilogram body weight, vitamin C is very safe. Okay, no significant side effects. And on this topic, let me briefly mention to you the oral vitamin C. The oral vitamin C is also very safe. The only side effect may be the so-called watery diarrhea. Okay, when you take too much vitamin C, that your gut cannot absorb all of it, you may have a diarrhea. Okay, this is what Dr. Cascott said about tolerance. Okay, and actually, this is a side effect, but also some people like myself use it as a therapeutic effect. I use this bowel tolerance or watery diarrhea as a treatment. I use it for bowel cleansing. A lot of people go to get colonics, or a lot of people have irregular bowel movements or constipation. And actually, I don't use anything else. I use high dose vitamin C and I use magnesium. Those are probably the two most widely deficient, many of them. The vitamin C and magnesium are two major nutrients that many people are deficient of. So with these two, I haven't been there has never been a case that I cannot solve their constipation problems. And so vitamin C is very safe. And let me also share with you that I think many of you are aware that using this vitamin C bowel tolerance treatment, we can treat food poisoning. And if you eat too much, I advise, because here in China, a lot of business people, they have to drink, they have to eat. I tell them, well, some of them for business purpose, but if you don't like what you ate, you go home, take a lot of vitamin C, get rid of it. And vitamin C increases alcohol tolerance because it detoxifies with alcohol and improves the liver function and everything else. Okay, now a few warnings on high dose IV vitamin C. These are very occasional. The first one is very few renal failure have been reported in the literature. These are usually among the patients who have pre-existing renal conditions, renal problems. So for average people, this shouldn't be a concern, but if the patient has complicated particular renal problems, you want to monitor carefully. And you may want to ramp up the vitamin C gradually, and you may even want to measure the plasma vitamin C level. And actually, in our opinion, let me add here, a lot of people on the website and talk about the vitamin C and kidney stone. And actually, vitamin C probably can reduce the kidney stone formation, not increasing it, okay? And those people who develop, there has never been a study that proves vitamin C is the cause of kidney stones. Yes, vitamin C, one of the metabolites of vitamin C is oxalic acid, okay? But the calcium oxalate is the major kidney stones, okay? But in those people who develop kidney stones, calcium abundance or overloaded calcium is probably the major cause, okay? We believe most or many adults and seniors have too much calcium, particularly if they are supplementing oral calcium. We advise do not supplement calcium. Osteoporosis is not a disease of calcium deficiency, okay? Osteoporosis is a deficiency of vitamin C, magnesium, and hormonal imbalance and other issues, not a deficiency of calcium. This is beyond the topic of this presentation. Now, for people with G6PD deficiency, particularly in the Mediterranean area, and high dose vitamin C should be administered carefully. In general, the lower doses under 10 grams or 15 grams, the vitamin C can still be used without major problem. But you want to screen in a screen for G6P deficiency. Okay, there's a recent article, I think it was last year, by Dr. Merrick that reviewed the literature on G6P deficiency. And the conclusion there is that lower dose, under 10 grams in particular, you don't have to worry about it. The hemolysis will not happen. And some people ask about oral. Oral vitamin C, we can never reach the level of IV vitamin C. Okay, even IV vitamin C of 10 grams that will not cause a major problem in G6P deficiency. So oral vitamin C supplementation, you cannot reach that level. So we shouldn't worry about it. And also high dose vitamin C will increase the absorption of iron. So people are already high in iron. For example, hemochromatosis patients, we should be careful with high dose vitamin C. Let's talk a little bit about mechanisms.